To understand the history of the UHI, you have to understand the history of the relationship between Hopkins and particularly the medical complex, medicine, nursing, public health, and the community. The impetus for establishing the UHI was to create a bridge, a dialogue, an environment where Johns Hopkins University and the neighborhood, and particularly the East Baltimore neighborhood, would have a far more harmonious relationship. When we began in 2006, we looked to establish mechanisms for building those bridges. And it was extremely challenging and extremely difficult. My predecessor decided that it would be a really good idea for the Urban Health Institute to establish a, quote, free clinic, the Caroline Street Clinic. It shifted the healthcare, embedded it much more in the community. We had the opportunities to have numerous conversations that went beyond the clinic with our neighbors and both what they needed and what they wanted. What Hopkins does well is healthcare delivery and education. Why can't we develop a program for the community that uses Hopkins' expertise as educators, that identifies people in the community who are not only leaders, but have skills as educators and mentors, and build that for community leadership development. And from that grew the Bunting Neighborhood Leadership Program, which throughout my career, when I look back on my career, is probably the most exciting thing that I've ever had an opportunity to be part of. What I said earlier applies to the next 25 years as well. Listen to what people in the community are saying. They're smart, they're hardworking. These are the people who are our neighbors. And if we see our neighborhood as a vital life force and celebrate that in every way we can, and that is to make them partners in the work we do, we'll be strong and we'll continue to be a lot stronger.